The Center for COVID Control is an Illinois-based company that operates a series of free, no-appointment necessary COVID-19 testing facilities across the United States. One of the company's testing sites is located in Dartmouth, Massachusetts. On January 1, 2022, I visited this location to receive a PCR COVID-19 test. Despite the company's website specifying that the Dartmouth location would be open for testing at 9 a.m. on New Year's Day, the facility was closed with a line of confused patients forming in the parking lot. A quick glance at the location's Google listing showed just a 2.7 out of 5-star rating, the majority of which are 1-star reviews. Complaints include week-long waits to receive PCR test results, incorrect or inconsistent test results, insufficient staffing, overcrowding, supply shortages, a lack of signage, and unanswered phone calls. Two of the complaints on Google about the Dartmouth site and delayed test results were met with a response from the Center for COVID Control. 4 weeks ago, they responded, "Thank you for your feedback. We are currently looking into this matter. Unfortunately, due to the increase in COVID-19 cases, our lab has received an extraordinary influx of COVID-19 tests. We are slightly backed up. However, we are working around the clock to ensure everyone will get results as fast as possible. We apologize for any inconvenience this may have caused. If you have any questions, please call 844-777-1237. The Dartmouth location has also received negative attention on the Dartmouth Helping Dartmouth Facebook page and was recently referenced on the Dartmouth Police Department's Facebook page as a business that should be viewed with caution. On January 12th, Providence NBC affiliate WJAR announced that their investigative news, or I-Team, reported that the state of Rhode Island was cracking down on unauthorized COVID-19 sites. The Center for COVID Control operates sites in Smithfield and Warwick, Rhode Island. Thomas McCarthy, Deputy Director at the Rhode Island Department of Health, told NBC 10 the Center for COVID Control is not authorized to conduct testing in Rhode Island and would be receiving a cease and desist from the state of Rhode Island if a resolution with the reported issues could not be reached. Many of the complaints about the Center for COVID Control were directed to the Better Business Bureau, where the company currently holds an F rating. A quick Google search of the Center for COVID Control reveals a slew of articles detailing that the company is under investigation in several states across the country. Newsweek reports that the company is owned by Elias Syed, a 28-year-old Illinois resident who is also listed on LinkedIn as the Chief Executive Officer at Bullseye Axe Lounge, a chain of axe-throwing venues also based in Illinois. A phone call to the Axe Lounge was taken by an assistant who passed along Bristol County Media's request from Syed for comment. Shortly after, BCM received a return call from Syed's husband and business partner Ali Syed. Although the Center for COVID Control has released a statement to the media, this phone interview with one of the company's founders is exclusive to BCM.
How did you guys get into this COVID testing business?
Aliyah and we were married in 2016, and we started various different small businesses, and then we would move up to a slightly bigger business. We had opened up an axe throwing lounge, and during the grand opening of our second location was the first day of the government mandate where our businesses were forced to be shut down. So when that happened, we actually were devastated because, 2 kids and having to have a new mortgage, we just didn't know where we were going to make ends meet. We were actually in line to get a COVID test, which was about a 6-hour wait. And my wife was like, hey, what if we were to provide a COVID testing site? So we started doing some research and called some labs to see what the legality was behind it all. And we found out, we teamed up with the lab, which pretty much stated that we could use their credentials to open up a drive-through testing sites on their behalf. The businesses that were shut down, we converted them into drive-through testing sites. And we saw how many people were lining up. And then from that point on, it just grew. Other people were like, hey, we want to get involved. We'd like to open up a testing site as well. And the next thing you knew, just 11 months later, we were looking at 300 testing sites throughout the country.
Couldn't help but notice some of the controversy surrounding the organization, especially since they have a location here in town. And I was just wondering how the organization is responding to the multiple investigations that are occurring across the country.
That's the frustration part for us, right? If we were people who had malicious intention to scam people or do all these accusations that were made against us, right, we wouldn't have made it to 300 locations. The truth of the matter is, all the way up until just a couple of weeks ago, we actually had been praised by news media and press. We were on the news 6 different times, and all 6 times was positive press. What transpired that led to all of this was this new strand had hit the country hard, right? And us being very very reputable with Google, at the time we had good ratings in all these locations, and we were ranking number 1. So tons of people showed up. There was lines going around the corner. With all of our locations combined, we were doing about 8,000 to 12,000 tests a day, and that number shot up to 90,000. And its numbers jumped up 10 times what we were doing the night before. It was not like the Center for COVID Control is the only people struggling. Like CVS and Walgreens pretty much claimed that they ran out of supplies and stopped testing. And not to mention, our employees are hit the hardest. So during this time, not only did we have a high influx in numbers, our employees were getting tested positive, so we were short-staffed.
To summarize, it sounds like the Omicron variant kind of caught your organization off guard. Is that fair to say?
Definitely. The frustrating part about this whole thing is like if people just looked at the service we were providing and how many people we were serving and how long we've been doing it for, they would realize like, hey, perhaps we shouldn't be making the company's life difficult, perhaps lending them a hand on to figuring out how we can help solve some of these problems and to make their life easier, They wouldn't title us as scam artists or people who have ill intentions. The way it works is we got one bad press and, it was justified customers being upset because they were in line. The employees of these particular locations were overwhelmed by a number of people and then being short-staffed. And it all just kind of added up to, customers being unsatisfied. And it was the first time in our company history where we had unsatisfied customers. Tomorrow, we're shutting down all 300 locations for a 1-week training where we're going to just train all of our site owners and employees to go over training on HIPAA compliance. And we're going to do everything we can to provide people with the best service possible. So for the next 7 days, we are actually retraining all of our staff. If you come to our headquarters, we have 160 people that work at the headquarters. And then overall, we have 3,000 jobs that were created from this company. People who were affected by COVID had lost their jobs to COVID. The most frustrating part for me was like I grew up with a single mother, and I always told myself that, when I become a father, that I'm just going to always be there for my kids, and that had been the case. So I have a 4-year-old, a 2-year-old, and an 8-month-old. I would complain to my wife saying, like, is this all worth it? Even before this whole media thing, is this all worth it? Kind of getting to miss out on being there for the kids as much as we'd like to be. And then, she always responded saying, like, think of all the lives that have changed because of us, how many jobs we've created, right? So, like, that's something that kind of had us going. But last 2 weeks have been rough on us because of just these sheer accusations and just, calling us a scam. And the thing is, like, at this point, we don't know, like, if you go ahead and finally tell them our side of the story, is it all those news outlets, are they willing to share the actual story and say, oops, sorry, we were wrong the first time around, and this is the real story, or are they going to continue with their narrative? That's the scary part, not knowing.
Following BCM's conversation with Syed, MassLive reported that the state of Massachusetts had issued the COVID Control Center a cease and desist order. A copy of a cease and desist order originating from Dartmouth Town Hall could be seen wedged in the door of the facility. BCM has also reached out to both the Massachusetts and Rhode Island Departments of Health for comment. Massachusetts Department of Health Director of Media Relations Ann Scales could not provide a representative for an interview and instead issued the following bullet-pointed statement. The Department of Health's clinical lab program has been made aware of complaints related to the privately owned and operated Center for COVID Control business that has sites in Needham, North Dartmouth, and Worcester. The Department of Public Health performed a survey on January 12, 2022 to investigate complaints related to this provider, working in conjunction with the U.S. Centers for Medicare and Medicaid Services, which is overseeing the response to this out-of-state laboratory. The survey showed their Massachusetts locations are performing tests without the required state approvals, resulting in the department issuing cease and desist letters to the 3 Centers for COVID Control locations in the Commonwealth. The order, effective immediately, requires the Center for COVID Control to immediately cease providing all services that require clinical laboratory licensure by DPH. Municipal health departments from the 3 affected communities assisted with the delivery of these letters. Residents are urged not to visit the Center for COVID Control for a COVID-19 test. There are hundreds of testing locations across the Commonwealth, as well as COVID-19 rapid antigen tests, which are widely available at pharmacies or online. More information is available at www.mass.gov/gettested. The administration announced this week updated guidance via a public health advisory regarding COVID-19 testing. The Deputy Director at the Rhode Island Department of Health, Thomas McCarthy, could not be reached for comment. He directed BCM to the department's Public Information Officer, Joseph Wendelken. I asked Wendelken the following questions. Why an unauthorized COVID-19 testing site was ever allowed to open locations in Rhode Island in the first place? Were these sites ever inspected upon opening? And how long were these sites operating in Rhode Island? Wendelken responded with the following. Testing sites are requested to have specific certifications. When concerns were raised about these locations, we sent inspectors out right away. When our inspectors determined that they did not have the proper certifications, the sites were issued cease and desist orders by RIDOH. These locations were not reporting data to RIDOH. We took immediate action when they were brought to our attention. A question that remains unanswered from both states is how an unauthorized COVID-19 testing facility was allowed to open its doors in the first place. BCM will be sure to post additional segments relating to this story as it develops.